when I was 7, my stepdad was killed in a pretty traumatic way. And my mom did not shield us from it. There was a lot of people that tried to get her to do that. She's like, no, they are going to be around him. They're going to see his dead body. And we're not going to call it passing away. We're not going to call it he went to a better place. We're going to say that he died because that's what happened, and they need to learn that.
I have goosebumps.
You know, obviously the loss was tragic for us and affected us in a massive way, but it wasn't like this off limits thing to talk about it, and we didn't talk about it in a way that it wasn't what it was. We called it what it was.
Can confirm.
Yeah.
Can confirm. Being kids.
Yeah.
Meeting you and you being like, my name's Chloe and my stepdad died. And I was like, whoa.
You're like, that's crazy.
This girl's metal as hell. We should definitely, before we like post this, like trigger warnings everywhere, by the way. I was so mad. Like, I was just like
At her for not wanting. Yeah.
I was fucking irate.
Yeah.
I was like, how fucking dare you? Like, choose to leave us when you could be here longer. I was 17.
Yeah.
But like being a 30-year-old now, I look back at it and I'm like, yo, I'm so about bodily autonomy. She lived her life.
Yeah.
That was her fucking choice to make.
Yeah.
Imagine if she went through chemo when she did experience it and she was like, this isn't for me.
Yeah.
How bad do you think chemo has to be that you would rather die
than go through it?
Go through it to be with your family a little bit longer.
They've tried to take their life in ways that severely incapacitate them, and now they are bedridden. Now they can only communicate with eye movement, and it's like, and the parents are keeping them alive because they can't say bye. But it's like, if you unplug them,
sad.
This is terrible. This is, and I think this is maybe a crude way to speak about it. You unplug them from all these machines, they wouldn't be able to live on their own. What makes you think that someone who's attempted to take their life 6 times wants to live in this condition?
What makes me sad and devastates me about this way of like trying to shield kids from death is that then inevitably you stop talking about the person as much, and then you stop remembering, and then you stop telling the stories as much, and then they become taboo because they're dead.
In a world where discomfort is actively avoided, therapy is not accessible to many, we have found that talking it out has been a form of free therapy in itself. I'm Chloe.
And I'm Kelly, and we dive into topics like death, divorce, disordered eating, debt, and every taboo topic in between.
With that, who's ready to get taboo? Hello, hello, hello. Okay, it's working still.
Oh my God, I'm proud of you.
I lifted my hand away and it turned off. I'm a witch.
Pause. Same.
We knew this. We knew this to be true.
I wonder what kind of witches we would be. Like each of us.
You would be putting hexes on people.
Yeah, for sure. Obviously. I do that now with my withering stare.
You would not be a good witch. Well, no, you'd be a good witch.
You
but
cunt.
Like, you would be.
That was violent. Sorry.
You would be, what do you call that? Like,
careful now.
Revengey.
Oh,
you'd be a revenge witch.
Vengeful.
Yeah, there we go.
Vengeful witch.
Yeah.
What kind would you'd be the kind to be like, oh, I have this cream to rub on you.
Yeah, let me make you a tincture. I already do that shit. It's embarrassing.
I know.
Honestly.
I was gonna say, like, honestly, like if I could put hexes
You're
on
already
people,
putting
I'm
hexes on people.
already doing that. I'm already vengeful. Are you kidding me? People don't forget.
I wonder if this vest is too loud for the mic.
I don't know, but I was thinking like I really am now gonna order a vest because I love vests.
Yeah, this one I got on sale last winter at Aritzia.
Oh, fuck, I love Aritzia.
It's so good. And the things that I bought there, I am actually so happy I did. They've been staples. I brought this like basically just like a bodysuit, like a full length bodysuit.
Oh yeah, like a cat suit.
Yeah, like a cat suit. It's a tank top, but it's a full. It's pretty much like exactly what you have. It's just not ribbed.
Yeah.
I got that, and then I got this fleece that looks straight out of the 90s that is like exactly what I had when I grew up.
Amazing.
You know? Yeah. Just a classic fleece jacket.
Yeah, love.
But it's a little bit cropped, which looks so cute with the bodysuit.
Yeah.
And then this vest.
Cute.
And I wear them all the time. And
yeah.
I was like, I don't know if I should because, you know, I'm always like trying to shame myself when I'm spending money on clothes.
Same.
But it has been such a good purchase, and it was over a year ago, and I just wear it all the time. So
yeah, I mean, I like for Christmas, like shout out to my mom. Like she still like cares enough to like ask me like what I want for Christmas every year, and like everyone knows.
That's so cute.
I know, and everyone knows I'm a skirt girly. Like I love that. I never wear them on the podcast.
I just ordered a skirt.
Really?
Yeah.
Oh my God, that's a big deal for you because you're so picky about your skirts. I will wear any. Here's my thing that I've decided with skirts is that like one, I like the way that my body is. I do prefer more of like a pleated or like an A-line skirt. But I'm a mini skirt girly. Yeah. I do not like mid leg or like mid thigh or like
too short. Yeah, not that you're a short person, but like we don't have enough like leg for a mid-length one.
Yeah. Like I'm just not into that at all. Like I like mini skirts. Yeah. And so
a little skanky.
Like always. Just
honestly,
skanking it up.
I prefer all my clothes to be a little skanky.
I need a hint of skank.
Yeah, I need a tasteful skanky slut. Little sports bra.
Yeah,
a skanky little skirt. Yeah, a skanky little tank. Like just, I want to look like I'm giving slut a little bit.
But like in like
boobies always out.
See, I don't have that. See, for me, it's like I like because I don't have boobs. Like I'm like I just like want to wear clothes though that like I don't know. I don't like dressing. Like, except I always wear turtlenecks. I like a little bit of both. Like, I also like my hyperfixation lately has been like, I have like
go again with your duality that I fucking love.
It is what it is. I have this like one pleated skirt that I love that's like really short, but then I'll wear it with a turtleneck. So it's like, it's giving like slut on the bottom, but like church girl on the top. And like, I
love the juxtaposition.
Yeah.
Like, it's good.
Yeah.
Well, because I think that's it's a tasteful
slut.
Yeah.
And I just love the look of like, you know what it is
like
that like
church whore.
Well, always. I am a Leo rising. So like my most important thing, like if I want to feel good, my hair needs to look good, right?
Hair is the outfit.
Yes. And so I love the look of like turtlenecks when your hair is down and it's just like statement. Like you don't have this distracting.
Yeah.
I know you love a décolletage. I don't. Like I want my hair to be the focus, not my black of boob. You know, if I had huge titties, they would be out all the time, but I just don't have that.
Well, it's funny. I used to hate having like, and I don't even have like that big of tits. I just feel like on my body, it just feels big.
Yeah, like I would never have described you like 5 years ago as being chesty, but I feel like because I spend so much time with you now and I've looked at your boobs so much now, like it's like they're not like massive knockers. It's just that you are a small person, so it's like, damn,
they're stacked on a 5-foot frame.
Correct.
It's like I'm still like a C or D cup. Like that's not big. That's not like that's big. Not a big.
No. Whereas like
those are not big boobies.
I just have like a like this up is just small. Like it's just like this is like the smaller part of my body, and then like I'm taller. So like it's just like it doesn't like I don't have like there's no boob to like do anything with. It's just like it's just flat. Yeah. Not flat, but like it's just not what I want it to be.
Mine just take up a lot of real estate on the little
that's sick, brother.
The little frame that not that my frame is small, but like my short stature.
It's incredible. That's like I feel like my mom's kind of that. I mean, like my mom, like again, like secretly chesty, and like it's been in the last few years I've realized it. But like my mom is 5'2". Yeah, like my mom is also really small.
Yeah,
so it's like I think that it's just like when you're when you're only 5'2", 5 foot. Yeah, and you have like this little chest.
Yeah. Like a B cup would be proportionate on my body.
Yeah, that's fucking crazy.
That's not what we're working with.
Yeah, definitely.
But I went through a phase for a long time, like all of high school, hated my boobs. Like I just felt like, because it was before the era that we have like let go of the bra. So like wearing a bra like made them look even bigger. And so like in a sweatshirt or a t-shirt or a flowy shirt, it just like adds so much.
Yeah.
So then I just I only wore bralettes. Like that's when I gave up on the bra was in high school. Cause I'm like, all my friends are like a B cup. Yeah. And they're so cute. And they can wear any fucking shirt that they want. Yeah. And I don't feel like I can. And then that just like continued. And then now in the more recent years, I've just been like, well, I guess no bra is what we're doing. Unless the bra is the shirt.
Yeah, right. For sure.
Which, then boobies are really out.
Right.
But I don't know. I just like free the titty.
But I think it depends on boob shape.
Yeah, there's certain shirts that I will wear like a nipple cover because like if I'm sitting in a certain position, they are pointing down. And that is not an aesthetic that I'm going for. You know?
Like, yeah, see, like, but you and I also have like, okay, for me, like my boob perkiness is fine enough for me to not wear a bra. I wear a bra every single day because I'm old fashioned. Because I'm old because I am a pilgrim. But I don't like the shape of my boob because it's like a boob that's like this, and then all the fullness is in the bottom.
See, that's the porn star tit. That's what we're all going for.
No, I want big, puffy. I want them like up here, and I want them full. I want them hitting me in the chest. I love when it looks like just like when you wear a scoop neck and it's just like big old full titties on the top.
No, you know what I hate? That cleavage butt crack.
No, that's hot. I love that.
When I'm at the gym and like I'm moving around and
this is gonna piss me off that you're gonna complain about this. This is all I fucking want. You're already pissing me off.
The girls will get it. There is nothing like that I want more than just like the athletic girl where they just have like a little bit of a swell. Like it's not like they're not touching.
Shut the fuck
What
up.
I hate is like in a sports bra, I'm like doing an exercise and like I'm so far in it that I can't like adjust where the tits are, and I just have like a 4-inch ass crack in the middle of my chest.
Yeah, that's fucking hot.
No,
as
it's
shit.
not.
Yes,
it's like too matronly for me. Like I want like a perky little athletic tit, you know?
No.
Okay. Well, we disagree.
You have like a great like full I feel like your boob shape is so nice. Like where they're full is so ideal.
No, it's
like when you wear certain shirts and it's like they just like look so fucking full, like right here, like I want to take a bite out of them. I don't fucking have that, bitch. All the fullness is at the bottom. And then when I wear a shirt without a bra, like it looks like fucking shit because it's just like chest, and then all of a sudden fullness like right in the bottom. That's not cute.
No, it is. No, that's like what I wish I had. Let's trade.
Fucking done.
Let's find a surgeon who will just do like a little.
I'll just cut off just
a little transplant.
Yeah, but I also have thought about like if I were to make enough money to have like any work done, like I've said for years, like my tits. I would get my tits done. No, I would now. There's no, because I don't think I would look good. I don't have this to rock being chesty.
Well, what I think the misconception is what happens when what I notice with a lot of people who are like, you know, are on the smaller side or like have like a more petite frame, and they feel like, you know, they want like the big tits. They don't realize that getting like a massive upgrade in size, it adds a lot of bulk.
Yeah, I don't want that.
I think people all of a sudden feel like they've put on a ton of weight because they look. It drastically changes the way your clothes fit and like how you look in pictures.
Yeah,
and like having a full chest like makes you look bigger.
It does.
I totally think, and I think that's why there's been such a like a kind of a swing back toward like a lot of girls getting reductions in lifts and no implants.
The lift is a maybe.
Yeah, because the lift I would totally do.
Like just like a little,
just like pick them up.
It's same with my face, like just the tiniest little like ponytail lift right here. God, I would look so much better.
Same. I would look so good. No, but I realized too on my, like, I thought it was just like my boobs being like saggy maybe, but they just they truly just sit low. Because if I wear like a sports bra that like has, if I tighten the straps up or whatever, like I get that like under boob, like where it sits, it's truly, they just are lower.
Yeah.
I've come to terms with, okay, we're not saggy. We're
it's not
just
saggy.
low.
I would never
just
describe
had a complex
you as saggy
about them being saggy.
Right.
But I'm like, okay, no, they just sit lower on the torso, which is fine because then you get the décolletage. So I'll take it.
Right.
But I think a lot of girls have regret after getting like a massive like boob job, like going up like several cup sizes, because now all of a sudden they feel like, oh, now I look bigger. Yeah. And I didn't expect that. I was just trying to get some cleavage.
And this is like hot take. I'm not just bringing her up because I love her. Like, I think my favorite boob job of all time is Taylor Swift.
Oh, best boob job ever.
Because
the most perfect tits.
Because like out of nowhere, they're fucking enormous, but they're also so natural. The minute
I don't think they look enormous. They just they fit her frame.
They fit her frame, but like she wears certain things and it's like, damn, she's got tits.
She got titties.
But also that could just be the piece, right? Like a little push-up moment, whatever, which is great.
Yeah. You squish them in the right way and they look full.
They look huge, yeah. But like I cannot fucking stand the way fake tits look. And it is so rare to see fake tits that like don't have that like obvious separation where they look hard.
Yeah,
every celebrity.
That's when because I've watched a lot of plastic surgery.
Because natural tits are hot. Like the movement of them is gorgeous.
They're squishy.
I love it. Yeah, I love.
The thing is, what I've learned is that that's kind of like when you've gone too big. Like when you try to put too big of it, like, cause you have to be able to fit the implant underneath the muscle.
Yeah. Right.
And so like, if you can't get that there, then it's just you like get, that, like you can see like the rippling of the implant. Shit. It just doesn't look good. Yeah, exactly. Or you get like an encapsulation where it, like, I think it's a scar tissue situation that happens, whatever. But even like celebrities, there's like I've seen, right way to do it.
Yeah, but like even celebrities I've seen where like, because like I'm on the side of TikTok right now. It's funny that we're talking about it, but like it's like plastic surgery, like breaking down and everything, and like there will be these like Hollywood celebrity, like world renowned surgeons will be like, oh yeah, this is like a great pair of tits. But like even if they're done well, I just think that the like when the boob looks hard and then when there is that separation, like there's an influencer who just like she went from being flat chested because she lost a ton of weight, lost her boobs completely, got her boobs redone recently, and I'm like, you look like shit. Like your boobs look rock fucking hard. And like I just think what makes boobs look good is if like when they jiggle and move. Like I think it's so fire. Like boobs are so fire. I'm a boob girly for sure.
Yeah. Oh,
and like
interesting.
Big time.
No, I'm a booty girl. Like,
no way.
That line about the got an ass that could swallow up a G-string, but up top 2 bee stings. Yeah, I'm like,
no.
That's my.
I feel like it's like whatever you have though, you are into the opposite. Like
correct.
I'm not. I have an ass and I don't give 2 shits about butts. Like I
love a booty.
No,
I
don't
love
care.
It. Eat it up.
No way. Anyway, so on that note, that's our intro today, talking about ass and tits. I almost said ats and tis. That's not right.
That's a little crazy.
Tits and ass. I'm really having issues speaking today.
We're in the Mercury retrograde, at least shadow, if we haven't gone full retrograde. I don't know. But
what did the full moon in Taurus mean last night, by the way?
Oh, dude. So this was a kind of a spicy one, actually. I was just talking to my aunt about this. So full moon in Taurus.
It was gorgeous last night.
I didn't get to see it when it was rising, and I'm so sad about it.
Because it was like foggy last night, so it was like
I saw
covered by clouds.
Like it was probably 15 minutes after it had been like that massive big one when it's rising, you know? But it's conjunct Uranus. So a full moon in Taurus usually actually is pretty stable because the moon likes to be in Taurus. It's at home in Cancer. It's happiest in Cancer, but it really likes being in Taurus also. So a moon in Taurus is usually pretty stabilizing. But this one was conjunct Uranus, which is a really eccentric. It's the rebellion. It can bring a lot of chaos, disruption. So the moon was conjunct that. A full moon is already kind of a chaotic energy. Yeah. And then it was conjunct a chaotic planet and squaring Mars, which is slowing down, about to station retrograde. So it was a hard angle between Mars, which is aggression, anger, cutting, severing, all these things, confrontation, for sure. Yeah. And it was squaring the moon, which is emotional, and Uranus, which is chaos. So it was just creating a lot of emotional tension and a lot of chaotic energy.
Let me think.
Which for you was it in your 10th house, which was work. You had a chaotic week with work.
Broke my fucking back at work.
Squaring Mars in your first house, which is you have a massive amount of inflammation in your back. And Leo rules the back. Oh, let's break that down. Okay, so you have Mars in your first house in Leo. Okay?
Yeah.
Okay, so Leo rules the back. It also rules the hair, but mostly the back.
Yeah.
Mars, which is like an inflammatory, especially when it's squaring Uranus, it can be sudden. It can be muscle spasms.
That's crazy.
And the first house is your body.
Oh, interesting. So my body got fucked.
Yeah. So you were having this square between, and then the moon is like emotions, and it's trying to be stable, but it's like the stability is being impacted, like inflicted.
Yeah.
Basically afflicted. Yeah, afflicted.
Yeah, that's a word.
So you had a flare, a muscle spasm that was debilitating in your back that drastically affected your ability to work in a nurturing role.
Yeah, correct. Okay,
moon is nurturing.
See, that is... okay, because I was just about to say before you said that, I was like, yeah, I kept seeing shit all over, like astrologers being like, watch out for this full moon, there's shit's gonna hit the fan, and I was like, nothing happened.
Signs the most but yeah, you had a chaotic week in terms of like work in your body.
Yeah, I threw at my back at work, so like I couldn't work for 2 days. It was fucking terrible. It actually still hurts. Heating pad engaged, but
and she has the weirdest little wormy lump on her lower back,
dude. But it's like it feels like a BB almost, or like a like, you know, from like a BB gun, like a
Yeah.
like
but it's so long.
Yeah, I guess so. Yeah, or like a perfect.
It goes like across the whole striation.
Yeah, it was really so like fine. I'll give you it because I was like everyone was saying it was going to be like this emotionally like tumultuous whatever, and like if anything
it's unexpected. So Uranus brings unexpected things, like things that just happen, like, and you couldn't have predicted that you were going to throw your back out.
Yeah,
like, that wasn't on your radar.
Yeah,
you know?
no, that was
like,
wild.
and for me, it was how with whiskey. So so my dog.
How are you?
I'm doing well.
Okay.
We haven't got the results back, but suddenly we found a massive lump in his testicle.
It would be in his testicle. That horny little bitch. I know. I love
Scorpio.
Him. Anyway,
and I'm like, so yeah, I got like a call from Kev saying that like, yeah, his like left nut is massive, and I'm like, are you sure? Because he's hung.
Yeah,
like.
Fucking yikes.
And it's so funny because just the skin on his nose and his balls is black.
That's
like
crazy.
His skin everywhere else is pink, but he's got a black sack, which I think is hilarious.
Please don't say black sack ever again to me.
Well, he doesn't have it anymore. So, so anyway, took him into the vet so we found it Friday evening. They didn't have any appointments on Monday, took him in first thing Tuesday morning, and they were like, just drop him off because we'll probably have to sedate him and like poke it basically and like do an aspiration. So then I get a call like literally 15 minutes after I dropped him off, and she's like, yeah, so this is likely a cancerous lesion. And which I knew, like in the back of my mind, I'm like, it's a non-tender, non-red, like lump basically, which like when you have if your lymph node, if you have a swollen lymph node that doesn't hurt, that's concerning.
Yeah.
So it's when it hurts that it's like, that's normal. It's doing its job. There's an inflammatory response going on. But like, painful ones. Yeah. Which is, that's totally normal. That means your immune system's working. It's on like overdrive. We like that. It's when it's not painful and it's persistent. That's when we're like,
Yeah. Yeah.
So he had a non-tender growth. And so she was like, what I would recommend is a neuter. And then we'll send everything off and it'll tell us like, you know, what this is. Sure. She's like, we also could just x-ray it and see what things look like on an x-ray, but we would also have to probably sedate him for the x-ray anyway. So I don't, you know, she's like, you can do either. We don't have to do everything right now. We don't have to do anything at all. But this is like what I would recommend. And she said that, you know, if we're going to sedate him anyway for their x-ray, it's probably a good idea to just also neuter him. And she's like, but you know, if we're just going to neuter him, we don't necessarily need to do the x-ray because we're just going to take it anyway. But she said she did want to look at, so these type of cancers, when they are in in the testicles, they are usually just like isolated to just that area.
Great.
So they usually don't spread, but if they do, it's usually the lymph nodes in the groin. So she's like, so we'll do an x-ray just to make sure that looks clear. We'll get results back from when we ship his nuts off. And so she's called me and said that the x-rays look great and that they also did x-rays of his chest, because a lot of times Goldens or like labs, like any kind of retriever will get like chest lesions. Yep. And so it's called like metastases, or like in the medical field, we call them Mets. So sometimes you'll get like a primary cancer in one area, then you'll get Mets to another place. And a lot of the times the Mets go to the lungs. Yeah. But she said everything looked great.
Amazing.
So that was really reassuring.
Yeah.
So I called her back like right before she was doing the procedure. I'm like, hey, while he's under, I've been wanting to get him in this year for like a dental exam and like cleaning. Sure. Cause he's 9 and he's never had like a proper teeth cleaning and it's just, he's due.
It's time. Yeah.
And he had like a chip on one of his canine teeth. And so anyway, she's like, I think that's a great idea. And I really loved that she was like, yes, I think we should totally do this, but she didn't suggest it because I think she didn't want to like, almost in a way, like try to come off like she's capitalizing off this, like, you know,
this terrible thing. Yeah. Yeah.
And the whole time too, she's like, I have time to do this today. She's like, you have plenty of time. Like, I just need to know by noon if you want to go through with this. Yeah. And this was at 8:00 in the morning. So I'm like, yeah. So we decided to go through with it. She does the cleaning. He had a tooth that needed to be extracted. Another one that didn't look good, but she did an x-ray and she's like, actually, it looks really good on the x-ray. It's just kind of a weird color. Yeah. So all that came back great. And when I picked him up, she's like, honestly, given what we were working with, this is a very simple recovery. He basically just got neutered and got a tooth pulled.
No big deal.
Totally normal.
He can handle that.
So he's on gabapentin and like an NSAID basically for inflammation. So yeah, it's just been like pain management and trying to keep him to like from jumping, which he just like, even if we're going to go out for a walk, like we'll be walking out and he gets so excited that he does a random jump.
Yeah.
So
what a pony.
I know. So he literally is like a little pony sometimes.
He is.
So it's just been trying to manage that, like him from getting too excited. But anyway, so that's my full moon in Taurus, conjunct Uranus, square Mars.
All of the, it is chaos.
Yeah. It's like Mars is also conjunct my Mars and moon and in my 4th house. So like, you know, home things,
family things.
Yeah. Family things. Yeah. So it's, and then, so that was my full moon story. A little bit of a chaotic, didn't expect that to come up. Also didn't expect a $2,300 vet bill.
Dude. Yeah. Fuck me.
Yeah.
That's insane.
Same. But like the nice part was like with the teeth cleaning, that's usually just $1,200 on its own. She only charged me like $400 for it.
Incredible.
So like
incredible.
She gave me a bunch of discounts since everything was like same day sudden. And I think she just felt sorry for me.
I think that's really valid and understandable.
It was really nice because it definitely could have been like over $3,000 and she kept it to like 22, 23.
Yeah. I feel like this is like a really good lesson and like don't get a fucking pet until you're financially stable. Correct. Or like have a really good job. Yeah. Because like that, if that were bully, like we'd be fucked.
Well, and the thing is like you could make the argument, oh, it's because he's an old dog. Well, you know what? When he was 2, he also had to have a $5,000 surgery because he ate a bunch of saran wrap. Yeah, exactly. So it's like, it doesn't matter that it's like, you're like, oh, I could just get a puppy now. I won't have to like pay for it till I'm older.
Lies.
No, they are expensive.
The whole time.
And it can financially ruin someone.
It can.
And what's sad, what I hear from a lot of vets actually, what's sad is that like the hardest part about that job is the amount of people who don't have the money or don't think it's worth it to go into debt for their pet and just put the dog down or put the cat down. The amount of, they said, like what I've heard over and over is the amount of animals that have to be put down because they need a surgery that someone can't afford.
It's not, or you could even go another step further. Like I remember my most recent ex was like very weird about animals.
Yeah.
I don't want to say weird. It's just that I have a very different look. Like he would have sacrificed his entire life for like his cat to have a surgery, not even like a life-saving one. Okay. And like was one of those people, like I understand it's really hard to watch like animals like die in movies and TV shows, but like he literally would have a mental breakdown about it. And I was like, okay,
you can be sad.
Touch some grass.
Yeah.
This is
weird.
But
we need to come back to reality.
This is weird.
Like it was just kind of poor coping skills.
Yeah. Yeah, exactly. And so where was I going? Oh, but like, you know, for me, like with bully, I'm very, very privileged and lucky that I have a family who has more money. They like make decent enough money that I know that if something were to happen to bully or he like had like something happened to him where he would have to have a surgery, they would help me. And I know that because I'm not in a place to be able to afford that. But I am someone that like, if it was one of those things where like I took bully to the vet and we found out he had cancer all fucking over his body, he was like mad ill and like all chemo or surgery would do is like prolong his life. No.
And I feel the same way about humans though.
I do too. Yeah.
I think a lot of the way we treat cancer is horrific. Mm-hmm. And I actually just watched this interview with a coroner and
such a fascinating job.
Yeah. And they were talking about cause of death on this cancer patient. And they were like training someone new. And this person was like sitting there and looked like they were really struggling.
Yeah.
And the person who was like the kind of the senior position training them and asked like, what's going on? They're like, I'm having a really hard time deciding what to write for cause of death. And they were like, well, what's coming up? And they're like, you know, so it's like this cancer patient that was receiving a ton of radiation, but the cancer is not what killed them. It was the radiation. And so the person was like, so what are you going to write? And they're like, well, it would be untrue to write that it was like liver cancer or whatever the cancer was.
Right.
But they were like, but I'm afraid I'm going to get in trouble or get pushback for writing radiation poisoning. And he's like, the only person you're going to get pushback from is me if you write something that is untrue. You have to write what killed this person. And in this case, it was radiation poisoning. And so like, and I just can't imagine like being in that position where it's like,
this is interesting.
Yeah. It's like, I don't know, it's like an ethical issue because and this is what happened with my grandpa, right? Like he didn't die from multiple myeloma. He died from kidney and liver failure because his organs were shutting down because of all the chemo, the radiation, and the pain medication to prolong his life.
Yeah.
Right.
Yeah.
So it's not like the treatment. I mean, and I get like in some cases people are cured, but it's like, at the cost of like how much life did you lose in those years where you were like under treatment, and what if it doesn't work?
And it depends. Like if the patient who has cancer is like, pump me full.
Correct.
That's fine.
Do it.
That's your fucking
Do
choice.
it.
But like when there are people like that are power of attorney or that like are pressuring someone with cancer into like, no, you need to stay as long as possible. Like, I'm sorry. It's understandable, but it's selfish.
Well, and I see it with family members all the time that they like, and I see it less in the emergency department than I would if I was working on a inpatient unit, right?
Sure.
Or like an oncology unit.
Yeah,
but there's so many family members who. So here's something that's interesting, actually. So you can have a power of attorney or like a medical power of attorney, an MPOA.
Just learning about this in school, by the way. It's very fascinating.
Oh,
another word for it. Fiduciary.
Yes.
How fun. Anyway, I'm sorry.
And which I learned about when I was in real estate, actually, the fiduciary.
Yeah.
But
love a good fiduciary.
So
that was a crazy thing to say. Sorry, that was an intrusive thought. Sorry, keep going.
we have to move on.
Sorry.
So you can have like your living will, basically. Like if this happens, like I don't want, like you can have a DNR or DNI. That means do not resuscitate, do not intubate. You can have that signed and say like, if I am incapacitated, these are my wishes.
Yeah.
If you have an MPOA, they can override.
What's an MPOA?
MPOA, medical power of attorney.
Got it.
So your MPOA can override your DNR, DNI. They can be like, no, do the compressions, do the intubation, do all life-saving measures, even though the patient has it written and stated that they don't want it. Now that they're incapacitated, the person that they've chosen to make decisions for them in their incapacitation can now.
That's why power of attorney. I think I understand why we have it, but like learning, literally, this is what I just did. Like one of my projects on for midterm that I finished yesterday was like power of attorney is a big fucking deal. You're signing your life away. Like you are. Like if something were, because eventually something's going to happen to all of us, right? And so it's very likely that they are going to have to step in and make decisions. And it's like they carry so much power that I think that's a perfect example of like they carry so much power that what they say is more important than what you say about yourself. Yeah. In cases
which is crazy.
like that.
Well,
which
it can
also
go the other way. Like if someone's like, no, I want all the life-saving measures, and maybe there's like a financial gain if that person is not alive anymore. And then the power of attorney can be like, nope, don't do anything.
Yo, that's kind of murder. That's kind of crazy.
Feels murdery.
Yeah, I think it's so interesting with cancer because like my grandma died of pancreatic cancer, which is like the bad one. That one's really bad.
Yes.
And, you know, for her, like it was real. I mean, it was like a classic case where like when we discovered it or like when she was diagnosed, like it was terminal. Yeah. Like they thought she had it like 20 years.
That's why that one is so insidious, is because a lot of the symptoms in the early stages of the cancer, a lot of people write off or are really not noticeable, quote unquote.
I was going to say, or
there
they
are
just
signs that like but it's like they're not obvious that it's like directly pointing to that. Right. And I think in our like medical system, it gets dismissed a lot. It's a lot of this, oh, it's nothing. Don't worry about it. And
heartburn.
And then
acid
it's like
reflux.
Yeah. And then it's stage 4. And
that's what happened. Yeah. And it's crazy with my grandma because like I was living with her the last few months of her life. And, you know, it's crazy to think about how like the symptoms, they went from 0 to like so dramatic. Yeah. And not only just like she was having such bad acid reflux that like she would have to sleep in like her recliner. And we were like, that's crazy. But like her personality, like her ability to cope was no longer there because I think her body was so fucking aggravated because it was shutting down. Anyway, so she found out she was diagnosed with pancreatic cancer in July. It killed her by that October. Yeah. It fucking ate her alive. Yeah. And it was incredibly painful. She was like truly the matriarch of our family in so many ways. And I was very close to her. So I'm not trying to, I don't know, seem insensitive here, but like there have been times where we have talked about my grandma dying and like at first they were going to see if they could do the Whipple, which is where they like fucking open you up all the way.
It's a very invasive surgery.
Very invasive.
They take like a whole portion of like the pancreas and like other parts of other organs. I won't get into all the details, but it's and they basically like create a new like attachment site after removing like a significant portion and function. And It's very invasive.
Well, and technology's so fucking cool, right? Because like my ex, his mother also had pancreatic cancer, and she had the Whipple, but like they can do it in a very like non-invasive way compared to like with my grandma. This was back in 2011.
Yeah.
It was a totally different time where it was like, no, we have to like butterfly her essentially. Yeah. And so, but the thing with it is because it's so invasive and like pancreatic cancer is so aggressive, like if they find even one spot outside of the pancreas, as you know, they won't do it. Period. And so they went to do it. They looked all over her body. They found like a spot or two on her stomach, and they were like, nope. Out of question. Yeah. And so then we were like, fuck, this is really bad. My grandma, like they were like, we'll do chemo to try and shrink it and like prolong your time. And my grandma started doing, and she like went through like a huge like mental fuck up from it, right? Because she's being told that she had terminal cancer. Yeah. Understandable. Yeah. And she did chemo for a minute and was like, no. Yeah. I don't want to lose my hair. I feel like fucking shit. I feel awful. And she refused. And there was times where, and even me to an extent, I was so, I'll speak for myself, to be fair. I was so mad. Like, I was just like,
at her for not wanting. Yeah.
I was fucking irate. Yeah. I was like, how fucking dare you? Like, choose to leave us when you could be here longer. I was 17. Yeah. Right. And I know that other people.
You have a smaller frame of reference. You don't have the same way of like looking at things that you would. And especially from someone who was in her 70s?
60s. She was like 62. Yeah, see,
that's the shitty part.
She was so young.
But it's like when you, not that that's old, I would still consider that middle age.
Me too.
But like you've lived a lot more life to have some different perspective about like, I don't want to do that actually.
Right. And like, I think, you know, on the flip side of that, like me being 17 and also just like how important she was to me and my family, all of us loved her so much that like not just myself, but like there were a lot of us that were just like, what the fuck? Fight, do whatever you can. And I do think there's people like that, and that's great. Yeah. But like being a 30-year-old now, I look back at it and I'm like, yo, I'm so about bodily autonomy. She lived her life. Yeah. That was her fucking choice to make. Yeah. Imagine if she went through chemo when she did experience it and she was like, this isn't for me. Yeah. How bad do you think chemo has to be that you would rather die
than go through it?
Go through it to be with your family a little bit longer.
I could
Something
not
to
agree
think
more.
about.
Well, and another thing that this is going to be controversial.
That's okay. I'm kind of here for it.
But I think it's an interesting thing to consider. The idea of suicide.
How do you feel about it? Trigger warning.
And this is, I see both sides, but I think it's like, it's worth the conversation to talk about like, who are we to decide that you aren't allowed to end your life if you want to?
Are you speaking in general or medically? Like if you were to have like a terminal disease, I mean, you could go either way, to be honest with you.
I don't think it matters because I think you could argue that like mental illness it can be terminal in the way that people end their life over it.
Well, I mean, they say that like suicide is the end result of depression.
Correct.
It's like the final symptom that kills you.
Yes.
It's not like, you know what I'm saying?
Yeah.
Like it.
And like, I just don't think it's like, I don't know. I have a hard time with the fact that we in like a medical setting or like that it's like the law basically that we can like say to someone, I know you don't feel good and you've never felt good. Like, especially in certain cases where people have struggled with it their entire life. Like they've never felt good. Right. And for whatever reason that might be, but to sit here and be like, yeah, but you don't get to make this decision for yourself.
I think it's
I'm not saying that like I'm for suicide. That's not what I'm saying. But I just think this is a tricky.
No. It's a tricky topic. So and like I want to talk about it because I, by proxy, have like experienced it. Yeah, in my life. But I want to like tread lightly.
Yes.
Specifically with this one because I have a lot of people I love that have dealt with it deeply. And I think it's really complicated because like I was always personally someone that, you know, as a kid, it was so easy for me to be like, yeah, suicide's selfish. Because
and I think that's the
family
narrative around it.
And I think that is a really common narrative around it. I think it's shifted a little, 1%, because we talk about mental health a lot more than like when we were kids. But yeah, growing up, I was like, yeah, how dare you? Like, again, it's always like, how could you do that to your family? I fucking get that. I do. again, I have watched suicide
up close. You've had a front row seat to it.
And to watch to watch the ones I love so much go through that is one of the worst experiences of my life.
Yeah.
So like, I do understand that and stand with that. Being an adult now, it hurts. It causes me so much pain when people say that it's selfish.
Yeah.
And like, I'm not trying to get emo, but it's like, can you imagine the level of suffering? And I think it's so hard when people are like, it always gets better, because like sometimes it doesn't.
Mm-hmm.
And sometimes, and people have such different coping skills, and people have such different levels of depression. And at the end of the day, if you believe in bodily autonomy, like if you are a woman who's sitting here saying, yo, I believe that a woman has a right to choose, which I'm very much that person, then who the fuck am I to say you have to stay alive?
Yeah. And I think it's kind of selfish on the family's behalf or the survivor's behalf to call the person who took their life selfish. It's selfish of you to want them to continue to exist here
because
for you.
Because don't want to hurt.
Yes. And I agree with you.
But again, this is complicated.
No, it is. It's so complicated.
I'm not saying you're wrong as a family member to feel that way.
And
it's
also,
valid.
There are so many cases of people who overcame their depression.
Yes.
And wanted to be alive and now help other people want to be alive.
And those people are heroes.
Exactly. They are someone who maybe had their life saved when they attempted to take their own life.
Yep.
So it's like, okay, you know, are we saving a life by resuscitating them? Yeah. With suicide, with cancer patients. Yeah. Or are we prolonging their misery by continuing chemotherapy and radiation by resuscitating someone who's attempted to take their own life 3, 4, 5 times? The amount of people that come in through our trauma bays who have attempted and failed. And you know, we get and report this is their 6th attempt. And now they have paralyzed themselves.
Oh my God.
Kevin's had multiple patients on his floor that, you know, have, you know, tried to, I won't get into the details. They've tried to take their life in ways that severely incapacitate them. And now they are bedridden. Now they can only communicate with eye movement. And it's like, and the parents are keeping them alive because they can't say bye, but it's like, if you
that makes
unplug them.
Me sad.
This is terrible. This is, and I think this is maybe a crude way to speak about it. You unplug them from all these machines. They wouldn't be able to live on their own. What makes you think that someone who's attempted to take their life 6 times wants to live in this condition?
I think about that a lot, right? Like I guess this is me speaking authentically with suicide, where I struggle so hard is that like, I think about the people that do attempt or that no longer want to be here. And it's like, okay, by like saving their life, one, what is their family? Their family better fucking act, or loved ones be actively there for them all the time.
But a lot of them don't have that.
They say go to therapy.
Yeah.
And that's not enough.
Yeah. And sometimes like, I mean, what happens too, like we get people that come in a mental health crisis.
Yeah.
And the only really services that we have for them until like maybe they come in on a Friday, it's going to be Monday or Tuesday before they can actually go to a facility where they can get help. So they spend 72 hours in a room with no windows.
That's going to make it better.
And like next to people who are screaming, belligerent, like it's awful. And like, that's our healthcare. That's our mental health care. Like we don't have a psych unit.
Yeah.
They took the psych units out of the hospitals and created 1 or 2 hospitals that have inpatient psychiatric services. Right. But there's not enough resources. So there's a backlog and not everyone can just get there. Yeah. And if you're discharged from us and it's recommended that maybe you check into one of these, we don't provide transportation. Get there on your own. Figure it out. Also, if you came here and you need help detoxing, sorry, you can go to Hooper, but is that a detox center? Got it. If you need help like coming off of alcohol, which you need to medically be supported doing that. Sorry, we can't help you. You got to get there on your own. But here's a recommendation.
Get there on your own. Yeah. So when you're completely incapacitated and unable to do that, and imagine how overwhelming it is, like to get your brain to that. And like, it's really hard to talk about this, to be honest. Like I'm struggling because every instance is so different. I think that suicide is something that you cannot generalize because every individual person has like a story with it, or like by proxy has a story with it, where it's like on the flip side, I think it's curious how suicide does tend to happen in masses, and it tends to be like contagious. And I think it's interesting how I'm not ever saying we need to talk about it more, but it has become so prevalent, especially with young people right now.
Well,
and what is that? You know?
Yeah. So we work closely with poison control. So they cool. If we get someone who overdosed or accidentally ingested or was whatever, poisoned in some way, the poison control, most of them are like nurses or physicians that now work in this setting. So they'll call us and give us their recommendations based on what they ingested and how much. Part of my job training is to do a shadow shift with the poison control team. So you're basically, it's like a dispatcher. Like you're taking phone calls like, hey, my, 8-month-old ate a tablespoon of salt. Should we go to the emergency room? Absolutely, yes. That could have severe damage to their brain. What I didn't expect was the phone call from the physicians about a 8-year-old who ate a whole bottle of melatonin intentionally.
Oh my God.
Yeah. And so that is crazy.
Yeah.
Like, what is that kid being exposed to? What are their conditions? What is going on at school? What's going on at home? What are they seeing on media that is inspiring them to take a whole bottle of a medication, basically, with the intention to not wake up?
At
8 years old.
To want to be dead at 8 is crazy. And that to me screams like trauma or abuse situations. But I also think it's crazy. And like, here's the thing is that I'm never going to be in a position to be like, we're over talking about it. Fucking absolutely not. We're not over talking about it. If there's anything I've learned over the last few years, like being close to it, is that like, it is so taboo. It is so taboo, and people are so uncomfortable with it. And like very recently, people that are near and dear to my heart lost someone to suicide. I actually
more
don't
than
know.
one someone.
Well, yeah, this is very recent. This is like in the last month.
Right.
Or 2.
Yeah.
And like,
are we talking about the same people?
We are, but like different circumstances.
Yeah. Which I remember we talked about it because it's like, again, they've already gone through this process multiple times.
This is the 3rd time in like 4 years. It's fucking awful. And what's hard about that situation is that like this person, and like I don't know the proper terminology. Some people say succumb to suicide. Some people say they lost someone to suicide. I don't know the right terminology there. So like correct me, whoever is watching this. But yeah, these people I love and adore, they lost someone to suicide, and this person who passed away, they were a teenager. They were 19, I think, 18, like, like a great school, great family. They were in therapy. They were so well taken care of. They were so loved. And they still succumbed to it. Right. And so it's like instances like that where it's like, what do you do? You have all the support, you have this great family, but like you're so young to be 18. I almost understand then the thinking process of like, it does get better. Yeah. And it doesn't feel like it. So that's where it's hard. I get the argument of like, me too.
Save them. They don't know yet. It's too early to make that kind of a final call.
It's so final, and it's so hard when you don't have a frontal lobe to be able to picture that far into the future.
Yeah.
There have been times where I have been in this like really like ideational place.
Small. Yeah.
And right where it's like, I'm like, I can't fucking do this. Like I'm so emotional. I'm so this, I'm so that. I can't take this anymore. And like being on the other side of it and being 30 it's like, holy fuck, it really does get better. It's less impactful. It's less like everything isn't as final when you're older. Like it really, like you get the coping skills, you grow up, you have the life experience. So it's like, this is why you can't generalize suicide. It's because sometimes there are cases where I'm like, if you just waited.
Yeah.
But who the fuck am I? I don't know what kind of pain they're in.
Yeah.
Maybe they can't wait. They've been waiting.
Yeah.
Right? Maybe this teenager who passed away, they've been suffering their whole life. I don't fucking know.
Yeah.
And I don't want to shame them when they're gone for doing this to their family when it's like they deserve compassion.
Well, and what's interesting is that we, in some states, Oregon is one of them, but in some states we allow death with dignity, which is assisted suicide.
Right.
Which is like,
I like death with dignity. That's cute.
Yeah, that's what that's
cute.
Like, what we're talking to, or how we're referring to it
love that.
now. And I love that because like my, one of my grandparents, that was his choice. He had a terminal cancer that took out most of his upper palate.
That was so sad.
And his sinuses, and he couldn't eat anymore. He was in pain constantly, and it was miserable. Yeah. And he decided to end his life, and that's allowed.
That's valid.
And
I think that's really okay.
And we say, okay, that's okay.
Right.
Something's happening physically to your body, so we understand, like, yeah, you have the right. But like if something's happening in your mind, and no, you lose that right because you probably don't have capacity is what we're calling it. But it's like, it's not necessarily a capacity issue. Like I don't know. It's just, it's so messy. And I think I'm extra like, cause one of my grandparents, that was their choice. My dad has a terminal illness. He's talked about it.
Oh, interesting.
Yeah. And
would you support him through that?
Oh, absolutely. We've had conversations about it. I asked him up front, like right after the diagnosis. And it was, I was almost kind of relieved to hear that he was for it or considering it because it can be like a pretty, just like, it's a shitty way to go, basically. And it's like one of those things like before he had this diagnosis, like I had a lot of conversations with people. Like I was like, I couldn't imagine a worse diagnosis. And
it's making me emo, but it's making me sad.
Yeah. Ugh. And it is sad.
I love your dad.
But the cool part with so he is diagnosed with ALS, and which is like a progressive neurodegenerative disease. So basically you progressively lose muscle function because your neurons are dying. So they're no longer like firing in a proper way, and they're dying off. So they're not even connecting with each other anymore. They're like not firing basically. So, most of the time it's kind of like a 2.5 to 5 year prognosis from the time you start showing symptoms. Yeah. But a lot of people don't even get the diagnosis until you're like 2 years in. Right. Because there is no diagnosis that says, yes, you have this. It's the diagnosis is we've crossed everything else off the list.
Right. I remember your dad going through this, and it was like they were just having to test literally everything else. Yeah. And if it was none of those things, then that's what he had.
Exactly. Yeah. And so there's like, you have like all these moments of hope, like along the way. It's like, oh, it's spinal stenosis. You can fix that with a surgery. All you need is like a fusion of a few vertebrae, or oh, it's MS. There's a lot of medications for that, or oh, it's like all these other things that it never is. And so you're constantly having like hope, and then being like gutted all over again. Totally. Which is interesting because the excerpt out of Daily Stoic today was about like hope and fear are just two sides of the same coin.
Yeah, yeah.
So
it's like post that. I was like, that's kind of beautiful.
Yeah. So that's interesting that it kind of ties in. But basically, it was just saying like they kind of come from the same place, and like a lot of the fears come from like the hope. Yeah. And so they kind of feed each other. But anyway, with him, his for whatever reason has been much slower progressing. Yes. And it's like hard to say, is it because the medication is actually helping to slow things, or, is it just I guess there's some sort of like differentiating piece in like they're kind of creating two different classes. Yeah. In ALS, there's kind of like a split off that they're now calling PLS. Oh. Which refers to the peripheral lateral sclerosis. So from what I understand is that it's you maintain your like peripheral function a lot better than for whatever reason some other people. That's awesome. Like my dad he's a very like he was a collegiate athlete. Like he's very athletic, has been like active and very fit his entire life, and has maintained his muscle mass. Yes. Which is
he's a fox.
Shocking.
He's a fox. Love me some Alan. Hopefully he doesn't listen to this. Yeah.
No, he doesn't listen to the podcast. Only when Polly's editing.
Damn it. Okay,
So
we'll
he'll
make sure he's
probably hear this.
Sorry, I love you.
So it is interesting, like, that he's maintained so much muscle mass. And I think because he is like, he's had so much muscle mass his entire life, I think also has helped, you know, the prevent a rapid progression of his disease process. But like, regardless of all of that, like when it comes to like a disease like this, you still have to be able to, when it comes to death with dignity, you still have to be the one to take the med yourself. No one can administer it for you. If with a disease like ALS, you lose that function.
Yeah.
So you kind of have to, like, it's like a race against decline when you're getting to the point of kind of making the call.
Yeah.
Because like, it's not something that I could, like, let's say he had a feeding tube at that point. It's not something that I could push through his feeding tube, because then that would be considered murder. He would have to push that through his feeding tube himself.
Right.
But it's like, if you're at a point where you still have the function,
then it's like, are you really wanting to do this because you have time?
Yeah, exactly.
Oh God.
So
that is awful.
Yeah. So it's like, there's a lot of, I don't know, nuance to it. It's kind of like,
I don't know that we've ever talked about that. That's fucking terrible. So, but you feel relief that he has considered it.
Yeah, because what happens with ALS is like you progressively lose your muscular function, which includes like your lungs, your heart, your digestive system. Like, so it's not just like your ability to walk.
Yeah.
But it's like, what happens a lot is like people kind of just like get pneumonia or like kind of suffocate because they can't breathe. And that's awful. Like
I don't want him to suffer.
No. And no one
does.
wants that. So he doesn't want that. I don't want that for him. So it is a bit of a relief that he's like
smart enough and
he doesn't want to basically just wither away to that point.
Yeah.
Right.
And hopefully he's also, I know he's also considering you and Polly.
Yeah. Yeah, exactly. And the thing is like too, like if you look at like with our pets, like you would never let your dog get to that point.
Right.
Why, like, you know, and I'm not saying like, okay, Dad, I'm making the call for you. Like that's not what that is.
Never.
But it's like, why do we allow like our human loved ones to suffer more than we would allow a dog or a horse or a cat or something? It's just, it's like an interesting, what do you call that? Like it's almost like more like intellectual or philosophical thing to consider. Like, and I think that there's so much like controversy. Like you can argue it both ways, and depending on your experience with it,
right,
you're going to have an opinion.
And again, circumstance by circumstance. Yeah. And I think it's true, like your experience around it. Like I think whenever I, like you brought up the hope and fear thing, and like for like whenever suicide comes up or is talked about, like again, so many conversations in the last few years in my life around it, just with the experience of it all. And I'm not the one that went through it, but it is coming from a fear place. I think that it is so unnatural for like, it's hard for our brains to process the thought of someone taking their own life when like that goes completely against biology. That goes completely against everything that we are made to do. Like that's crazy. But like, I wish that we could all, myself included, like I think about suicide a lot, to be honest with you, not in like that way. Just like, I think it's an interesting thing to like why people do it, why it's so prevalent right now, things like that. And, I wish that we could all, myself included, just stop and recognize like, exactly, you're going completely against biology. You're going against everything that our brains are telling us to do, which is survive. Right. So maybe things are actually that bad if someone goes through with it. Yeah. And that doesn't mean it's not painful and brutal, but like, I think like experiencing it by proxy so much over the last few years, like if there's anything I've learned is that like, it doesn't matter because at the end of the day, that person's gone and like, you just miss the person. Yeah. So like, instead of like shaming someone for doing it or being like, that's selfish, stop. Let's have some empathy. You can just say you miss them. Yeah, we can miss them. And it's also like, it's incredibly sad to think about like the frame of mind that they must have been in. Dude, I will start crying right now. It kills me. Yeah. to know that someone was suffering that
so
much
badly that it didn't it wasn't enough to like stay alive for your kids, for your wife, for your partner, your family. Like that wasn't enough because you were in so much pain. I think we can have some empathy for the person, like how sad and like it's hurting they must have been.
Anyone that has attempted, anyone that has ideation, I just have so much love and compassion for, because think about the family members that are so angry, that are hurting so much. They're like, how could they do that? How could they do that to us? We loved them so much. And it's like, no. The person who died loved you the exact same amount. And they're hurting so much that even that couldn't stop them. It's not
enough.
That is a pain that is unfathomable. Yeah. You know? That I don't think that anyone has experienced it who's here right now, because it is what takes people it takes that level to get people to a point of taking their own life.
And, you know, maybe there are people that have attempted and failed, but like are relieved that it didn't work because, you know, like they are here on the other side, and maybe they could speak to that feeling that you're talking about. Right. Cause like, they were in that frame of mind.
Sure.
And I think that there have been accounts of that. And I think that's like usually the narrative that we're fed. But there's also the narrative that I think is probably taboo to say is probably on the way out for some people. There's a lot of relief, because I think we hear the narrative of like instant regret. I shouldn't have done this.
Or they were scared in the moment.
Yeah. And like whatever it was.
We'll never know.
I think in school we heard an account of someone who said like, you know, they jumped off the bridge and instantly regretted jumping as soon as they jumped, but then like somehow survived the jump. And then now they're here to like save lives.
Oh yeah. They jumped off the San Francisco Bridge, the Golden Gate Bridge.
Yeah. And I think that that's like a common narrative, but like there's also the people who probably felt instant relief.
There's, I have a family member. We should definitely, before we like post this, like trigger warnings everywhere, by the way. I had a family member, I never met him, but Uncle Buck. And he was dying of emphysema.
Yeah. Painful.
Suffering. And that's like what he did. And and like, I've thought about him, not even knowing him, so much of my life. And I've like thought like, you're telling me that a dude who is essentially like drowning and like slowly, you know, like awful for his wife to come home to, but he waited until she went to the store and he made it to where like, this is morbid, but like easy cleanup. So considerate. Yeah. Like did it outside, all of these things. Dark, but like kind of great. And it's like, okay, great's crazy. But like you're telling me that in that moment, like he didn't feel relief, like just because he's not going to have to struggle to breathe. And that is just one instance, right? And there are times like I think where I'm struggling having this conversation like openly right now is that like we make jokes that we have a teeny tiny platform. Like whoever listens to this, it's mostly friends and family. Yeah. But like I still feel this like innate responsibility to handle this topic with care, because I do think it's important to like also establish hope and like that that like there are options. And I think that like providing love and a safe space for people to openly talk about like them thinking about it is okay. Yeah. And important. Yeah. But I also think the other side of it is like, if you feel like I'm not going to be someone that's like, don't do that. That's selfish. It's your fucking life. Yeah. It's your body. Yeah. Bodily autonomy. Like, sorry, dude. Yeah. I just like really feel like your family's like, I don't know. It's hard for me to say, but like, the shame around it is astronomical. Yeah. And it's like dude, if we're people, gone.
Well, and that's what's hard. It's like, if you're someone who like supports bodily autonomy when it comes to like abortion, the right to choose, when it comes to vaccines, when it comes to death with dignity, like all these issues, like these are like, it is your body. Right. But then it's hard too. Cause like I'm in a job where like I'm a mandatory reporter.
Ah, that's interesting.
Yeah.
Interesting.
So like,
talk to me about that.
If someone is like expressing SI, which is suicidal ideation, I am required by law to maintain my license to report that.
I, as a nanny, am also that way.
At the end of the day too, like I don't disagree with that either, because I think if someone's in a place, like a dark place where they need help, they need help. And that's what we're here to do. But the thing is, it's like, what's sad is when when someone is reaching, because I see this a lot too, when someone has made all the efforts to get help and they have doors closed on them over and over and over
Thank
and
you
over.
for saying that.
They made every effort.
They did everything right.
And then it's still, the system still failed them.
Yes.
And they took their life over it.
Yes.
That is devastating to me.
Yes.
That's devastating.
Couldn't agree more.
I think it's,
I just got full body chills.
Yeah. And I think that's a different issue. Like
Yes.
it's so
layered. And I think here's the thing with mandatory reporting and people who are struggling with like ideation and all of that is that that's different to me though, because it's like, I do think that there's instances where people are struggling with suicidal ideation and they're not necessarily at that point yet. And I would rather take all the precautions and maybe I can help them.
Yes.
And that I'm okay with.
Yeah. Because I think
great.
you have a window.
You do have a window, but
before it gets to the point of
Yes.
like, you know, like perpetual suffering.
Yes.
Not coming out of this.
Right. And I think that for me, what's important is like once that point has come, because it does come for people, obviously, I don't understand dragging them when they're gone.
Yeah.
It bothers me.
Yeah. That is deeply upsetting.
It is the grossest, most shameful thing to me. Because at the end of the day, like, why can't we just say we miss them and learn from it and like recognize that if they were still here, they would probably be fucking miserable.
Yeah.
You know?
And then it's hard too, because it's like, I wonder, can anybody be like, is there a cure for everyone? Like maybe they haven't like accessed that specific,
totally
like way of help, basically. Like maybe they've had therapy, but it wasn't the right therapist or the right kind of therapy, or maybe they had medication, but it wasn't the right dose for them, or like they didn't have access to it. Like that's the other part too. It's like, is there a form of help that would work for everyone? You know, like on an individual basis.
I don't think
know.
I don't think so, only because like we said earlier in the episode, it is so individual. It is so case by case.
Yeah.
And I think that's...
Well, I guess, I mean, is there not a blanket one thing that would work for everyone? Like, does everybody have their own version of something that would get them out of the thing?
Maybe.
Yeah.
That's interesting.
Yeah.
Yeah. I'm sure it is. And I know that it looks so different. Well, I don't know. Because I think like I don't know if we've even talked about this on the podcast yet, but I think like a huge part of this is like our lack of comfortability around death.
Yes. Ooh, yeah.
I think that is a huge part of it, is that understandably we're all scared or uncomfortable with death.
Yeah.
And I think
that's ultimately what we're kind of talking about here is I think we've been so sensitized to it. It's been so removed from normal like society.
Yes.
It's something that has been like taken out. Like it used to be like you die in your home and then your dead body is in the home for the wake period for 3 days. And then you have a burial and everybody's involved in it. And now we've gotten to a point where it's like someone dies, they go to the morgue and someone else, like a funeral home, handles their body. We don't deal with it. And if you have an open casket, it's kind of creepy. But if some people can't even handle that and it's just cremation, or sometimes people's bodies are not in a, like they have to be cremated or whatever it is.
Yeah. Damn girl.
But like, that's not something that we are exposed to in the same way that we were 100 years ago.
Yeah. Let's talk about like, again, everything always comes back to kids for me. Talking about kids with death. The family.
Talking about death with kids.
Yep. Thank you. Dude, I'm
Mercury retrograde shadow.
All of my like sentences are getting like flipped around all day. The previous family I worked for, my non-current one.
Yeah.
And I've talked about this. I think it was with my mom and she like, and her partner, and they kind of disagreed. And I like, guess I get it, but I'm going to like rebut. If it wasn't them, it was someone. But the family I worked for was so matter of fact about death. And it was fucking incredible. Like their kids were like 2, 6, and 13, 14. I don't know. And like wide range.
Yes.
But especially the 6-year-old would, you know, he was like young enough to not understand or have the fear around death.
Got it.
Because 6.
Yeah.
And so he would like ask his parents all the time, like, mommy, are you guys going to die? Like what happened? Like who takes care of us if you guys die? And they were like, yeah, we are going to die.
Yeah.
We are. Yeah. At some point, and we don't know when it is, you're going to die too.
Yeah.
That's a part of life.
Yeah.
It is the end of life. It is something that is unavoidable. And I think, and like, he was so like, okay. And I think a part of that is that he was 6 and like didn't understand the permanence.
But it's also, I think it's healthy to like just make it like an appropriate thing to ask, you know, like because it makes it like it's only when you're weird about something that a kid learns to be weird about it.
Right. Well, and that's
or
the
to
thing.
feel weird about it because they sense your uncomfortability.
They see you. They're reading. They're not listening to your words. They're reading you.
Yeah. Right. So if you're uncomfortable, they're gonna internalize like, oh, this is something we have to be uncomfortable about.
Right. And even if kids aren't putting it together, they know and can sense when their parents are avoiding a topic.
Yes.
They're not fucking stupid. I will say that so many times throughout this whole podcast. They're smarter than all of us.
Yeah.
But I really don't remember who it was, but I was talking to someone about it and I was like, it was so dope. Like I was uncomfy at first, like sitting there watching it happen. But then I was like, no.
Yeah, this is
how it's meant to be. And whoever it was like, well, I don't know. Like that could really scare a kid. And like, here's my thing. Maybe.
You know what's scarier is someone dying and they don't know about death.
Correct. And my thing is like, why are we, this is where as a parent, like if I were lucky enough to have a kid, like it's so important to me to not, you want to protect your kids, but kids need to experience fear. I think it's okay for your kids to get scared because as a family, we can get through that together. I would rather do that. I would rather my kid be fucking scared and me support my kid as an adult who can explain and love them through it. I would rather that and them know about death than them be shielded from it and then grow up as like this adult who wasn't exposed, who was bubble wrapped, who then is an adult who's a hypochondriac, terrified of the world because they're scared of death. It is scary to think of because we have self-awareness biologically. Obviously, death is something that's really hard to conceptualize. Like not being here is weird. I'm someone that thinks about death every single day. I contemplate, I lay in bed in the morning and I think about death, and not in a dark way, just like a way of like, this isn't forever because I want to stay lukewarm with it.
Well, and I think,
you know,
I think when people can kind of come to terms with their own mortality, I think that is what is really,
it's freeing.
It's really liberating.
Yeah.
And it also, you appreciate what is precious.
Completely.
Because I think we can get flippant with things
of
and have a disregard for actually how precious our life is.
Yeah.
And how finite it is. And it's interesting. I saw something that was like, we are so kind of like flippant with like the one thing that we have the least control over or like don't know when it's going to run out, and that's our time here.
Yeah.
Like we don't know when that hourglass is going to run out. We have no idea what that is for us individually or with the people that we love, but we act like it's never going to.
Right.
So I think to be in touch with your mortality and like of the people around you, I think is really healthy.
I agree.
That I don't think we talk about enough. And as for kids, I think it's important for kids to have pets that have short lifespans.
I agree.
Fish, hamsters, like any kind of thing that has a short lifespan, because they need to encounter death in kind of like a repeated way, because they need that is such an important part of development.
Yeah,
and
I agree.
Like when I was 7, my stepdad was killed in a pretty traumatic way. And my mom did not shield us from it. There was a lot of people that tried to get her to do that. There was a lot of people that tried to get her to like, you know, not expose us to those kind of things. She's like, no, they are going to be around him. They're going to see his dead body, and we're not going to call it passing away. We're not going to call it he went to a better place. We're going to say that he died because that's what happened, and they need to learn that.
I have goosebumps.
You know, and it wasn't something that felt like, obviously the loss was tragic for us and affected us in a massive way, but it wasn't like this off limits thing to talk about it. And we didn't talk about it in a way that it wasn't what it was. We called it what it was.
Can confirm.
Yeah.
can confirm being kids, meeting you and you being like, my name's Chloe and my stepdad died. And I was like, whoa.
You're like, that's crazy.
This girl's metal as hell.
Maybe that's the Aquarian in me. But.
No, but like, I also think that it was really like, Kirk was, your stepdad, was always talked about. And it wasn't like, you can do both. Because I think what's scary, what makes me sad and devastates me about this way of like trying to shield kids from death is that then inevitably you stop talking about the person as much, and then you stop remembering, and then you stop telling the stories as much, and then they become taboo because they're dead. That's crazy. That's disrespectful. That's devastating. Like I just don't, I think that we've leaned so hard into shield the kids. They can't know about death. They can't know. We don't want to scare them that it's like, okay, well now they'll never hear about these fucking dope people because you're so fucking uncomfortable with death. I'm just as scared as the next person of dying. I think it's a really that's
your biology kicking in.
That's the bio kicking in. I'm only human. But I do think that if everyone just fucking stopped, like I know it's uncomfortable, but like I have watched so many people so close to me I love lose people in devastating ways very recently. And like it's forced all of us to talk about death more. And I think that it really did open my eyes to like you have to talk about it because then you can talk about them and that's how their memory lives on. The less sad and scared you are of death, the more comfortable you are talking about the dead and the people that have passed and leaning into grief. I mean, grief is a whole other 2-hour episode we could do. I'm so passionate about grief, but not avoiding grief. It's okay to miss people.
Yeah, and I don't think you can avoid it. I think it comes out in different ways. No, it's like, no, we're here.
We're here, bitch, and we ain't going anywhere. Yeah. And it's like how you lean into it. Like, don't even get me started. Like, Anderson Cooper has a podcast that is literally just about grief.
Oh, wow.
It is the
you shared that other clip from it the other day.
It is the most powerful, incredible, no podcast will be like that one because he lost his mom really traumatically and is like really open about his grief like Andrew Garfield is. And it's just like he has these people come on and talk about their experience with grief and everyone's experience is so different and beautiful and human and people avoid it and people don't want to deal with it. And I love this idea that is coming. The clip I shared the other day was Christopher Reeve, who played Superman famously. His son was on the podcast and was talking. And I've seen this trend more about like, here's the thing about grief is that it's unavoidable. And also like, death, it changes you when you lose someone you care about forever. You will never be the same.
No.
But it's a part of your development.
Well, and it's a crazy thing to like miss someone who is never going to be back.
Yeah.
Like that, I think is the hardest part about grief. It's like, it's not like
they're on a trip.
Yeah. They're not on a trip.
Yeah.
They're not like, it's not like you maybe had a falling out and like there's a potential, like they're out there alive and like you can maybe like mend things with them again. It's
that hope is gone.
They're gone.
They're gone.
Like you don't get to have a conversation in the same way that with them that you did when they were here and in a body that was alive.
Yeah.
I do believe in like people's spirits and I believe in reincarnation and I believe that we still have access to our loved ones and people that we've been connected to in this life. And I think that there's people that have like amazing abilities to be able to connect us with the people who are on what we kind of call the other side.
Sure.
And I think that they like people that have died that are no longer in a physical body. I think that they kind of act like our guides, or like, other people might call it like a guardian angel. I think that they exist, but what's painful is to like not have them physically here. Like I can't like hug them. I can't touch them. I can't
touch people.
Yeah. And so that, especially if you're someone who's like relies so heavily on the physical senses, like nothing is more, like all encompassing and like kind of like takes you to another place than like smelling that person again. Like when I smell my grandpa's cologne, you know, like
Yeah.
it's so powerful.
Or
right?
like feel like it's so crazy too, though. That's why like loving people is so like, not to get too existential, but I just think that like love is such an incredible part of being, it's the best part of being a human. But like I still to this day, like my grandma has been dead for 13 years.
Right. Yeah.
Right. And I lost her at such a young age, like I was 17.
Yeah.
But like I can remember, like I can close my eyes and remember how soft her skin was when she hugged me. Right.
Yeah.
And like I can like smell her like her suave hairspray and like all of those things like stay alive. And like it's fucking trash because it's never as good as the real thing.
Yep.
But I think that like,
but it's like some part of them like stays alive in some way. Right?
But like you have to be able to talk about it.
Yes.
And it comes back down to like the grief is so painful.
Yeah.
Grieving it is so fucking terrible. And you can grieve not just for the dead, but for like a moment in your life or like a part of your life. I've been grieving for the last 4 years, you know, and like it is so overwhelming. And I completely like, I don't want to sit here and like act like I'm on a high horse. Like, yeah, everyone needs to be like loving and compassionate for people who like take their own lives. And like, you need to lean into grief. Like, I'm not trying to do that at all. Grief is fucking terrible. Yeah. Death is terrifying.
And if you want to avoid it for a while, you can, but eventually you're going to have to deal with it.
And that's valid. But like, I want everyone to know that like grief is coming for you, babe. In one way or another, you're going to be forced to fucking grieve. And,
it's a part of being alive.
And it's a part of like the guy on the podcast was like, it's a part of, it makes you who you are at the end of your life. It's a part of your development. And I was like, that's so like, obviously like I don't want anyone to have to lose anyone, but that's unavoidable. But to look at it that way.
Well, and what because I had a friend who lost her dad this last year and she had shared something to cancer, pancreatic cancer. It was really awful. And it was like, it was just, it happened very suddenly. Like he was doing like, you know, in remission. And it's just like, it's really tragic. And, but she shared something about grief, and how grief is just like a massive amount of love for someone, right? With
every time I hear that, it fucks me up. It fucks me up. It fucks me up.
Yeah. With like nowhere to put it.
Yeah.
Right?
It's like you feel it. It's all the love. Andrew Garfield said it. It's all the love that you have left over, but they're not here for you to express it towards them. Devastating.
Yeah.
But beautiful.
Yeah.
But like so beautiful because then it's like, instead of you being mad, right? And instead of you, which is easier said than done. And instead of you being so angry that they're gone, like, dude, reflect on how much you fucking love this person.
That's what this feeling is. It's like wanting to love them, right? But like, they're not here, but you can still love them.
Of course.
Because you have all the memories, you have all the stories,
the smells, the touches,
the pictures, the food, you know, like all these beautiful things.
Oh, I know.
So yeah,
it's just devastating.
Yeah,
it is. But it is like, I just really try to think about it. Like, you know, my loved ones that have lost people so recently, like it's so hard to watch people go through it.
Yeah.
And I think that when you love someone that much, it's like you naturally want to grieve with them. And I think it's like so important. That's why like talking about it constantly and bringing them up is really like when they want to avoid it.
Yeah.
Because they're suffering.
Yep.
Right.
Because they don't want to feel the shitty feeling anymore.
They don't. And that's okay. And that's the thing. That's valid.
That's okay.
You can avoid it. Please know that you like, I feel like we're both saying if you're in a place of avoidance, go for it, babe. I am here for it.
But if you're also wanting to be fully in the anger, fully in the sadness, fully in the everything, go there.
I will always encourage people to be angry and love the anger.
Well, and I think it's cyclical. We've talked about this. Like with grief, it is cyclical. Like you kind of go through this roller coaster, but like every time you're at a high, the next low isn't as low as the last one. Yeah. The next high is a little bit higher than the last high. And then you have a low again, but it's still not as low as the one before. Right. So it's like you're climbing, but you are still dipping. And that's okay.
It's okay. And I think too, like, the way I like to think about it with like losing people is that like a part of grief is that it's okay to grieve the fact that your life will never be what it was.
Yes.
And instead of trying to get back to that place, that it's impossible, babe.
I have had this conversation and maybe with you also, but like I'm very intentional with my language. And one thing that I really try to avoid saying is I want to get back to how I was, because you're never going to go back. You never want to go back in time.
Yeah, why would you?
Because all those other things that maybe in the gap between at this place where you liked where you were to where you are now, all those things were super important to your development. All that you should be doing is focusing on taking the lessons from it and going forward. And maybe that looks similar to a different season because everything's cyclical, right? But like, we're going forward. Like, we never want to regress, because that person that maybe you're idealizing of yourself like 3 years ago didn't go through all this shit for nothing.
Amen.
And like, I when I was first starting therapy, that was the biggest thing that I realized. I'm like having all these feelings, right? Like, I'm angry. I'm like bitter. I'm like dealing with all these emotions that are uncomfortable. And then I realized, like, oh, this is grief. Yeah. I'm sad because I had a lot of things in my life that I loved that are not here anymore. Yeah. And it's like, it's not about like the death of a person, but like the death of who I was before all this happened.
But that is kind of a death, right?
It is a death.
It is.
Like, and now I get to be someone brand new, but like, it's still like, I love this analogy that there's a lot of like death that happens in birth.
Yes.
And birth is a painful experience. It's a traumatic process for both the mother and the baby.
You're born into trauma. Isn't that crazy?
Like you're
born traumatized.
Like, you're trying to like fight for your fucking life coming out of that canal.
Come into this world dying.
Like,
too real.
Whoa.
Fuck, dude.
Like, but I think that that birth part is like the extension of the death process. Yeah. You know, and especially if you're someone who does believe in like reincarnation, you know, like we go through death to be born again in a lot of ways and come into like a body form again. And all of it is really fucking painful, but like how cool to be alive.
Right. Right. And I think that like when you're talking about grief and like how you were realizing you went to therapy and you were like, oh, like I'm realizing like this is grief. Like this is the thing, is that like even sitting here having this conversation, you know, like we're not even like, you know, we're talking about like trauma that's happened to you and I in different ways, but that has triggered like us to like grieve old parts of our life, right? It's not that we're talking about like a death necessarily right now in this very moment, but it's like our lives were, without our consent, forced to change really fucking fast. And, you know, even talking about it, like I feel myself getting like, and like I'm in therapy, like I'm working through it, but like I feel myself getting angry and getting sad and like feeling all these things again. And it's like, that's the thing that's so hard about grief, is that it does waver. It's not like you grieve something and you're over it and you move on. Like if you love something, which like, you know, I loved my life before, you know, some shit happened. And it's like, that's the thing that's so cool about grief, is that it's so personal that you're allowed to grieve it whenever the fuck you want. I'm grieving it right now. Like you talk about it and you get so angry and you get so emotional, but then it's like you have the coping skills as time goes on to be like, okay, we felt that. Now let's keep moving forward. Yeah. And allowing yourself to feel it is such a huge part of what propels you forward. You know?
Wow. Yes. Because I think we would not be sitting here.
Correct.
We would not be able to engage in the way that we're talking right now. Correct. Without having those really challenging things, the death of a season, and that grief that, like you're saying, propelling you. We wouldn't be here. No. We wouldn't be in the relationships that we're in, the jobs that we're in. We wouldn't be pursuing the things that we are.
We wouldn't be doing a creative project.
No. And that's the thing. Know? Like I credit this project to kind of like a lot of what has kind of saved me in the last year.
Oh, I love that.
Yeah, because I brought it up in therapy because I was talking about like how challenging, like, you know, the living situation is and whatnot. And like, you know, it's like a finite amount of time in some ways that's like left. I'm not going to be here forever. Right. And she's like, well, and I was like, and so I kind of have to focus on other things. And she's like, well, what are those things? I'm like, it's this project. It is doing things that I deeply enjoy that, I mean, serve in some ways as a distraction, but more of something else to channel my energy into.
And invest in yourself.
Invest in myself, because I could channel all my energy, my mind, my attention into how shitty this is, how much I hate my living situation, how frustrated I am on a day-to-day. Or I could take all that energy and put it into being creative and doing something that I love, playing, having fun, expressing myself, trying like something new.
Yeah. And like, we're like, I think it's really where you and I both are people that like we're extroverts, but it's really easy for us to like turn inward. I think this project holds us accountable to like have intentional time with each other. And I think that that has been so healing. And I think that us, like, you know, I think that therapy's amazing, and I could not recommend
Thank God
it more.
We both got professional help.
Yo, I don't know, man. I started therapy and it's like a fucking weight. I'm just saying I recommend it. If you're grieving, just try it. Just try it.
Give it a shot.
I don't know. It could be great. Whatever. But get there on your own, obviously. But I think that
this is coming from the girl who didn't want to go to therapy for like 4 years.
For years.
So
the last 4 years have been so fucking traumatic for me, for the people around me. It's been so fucking hard. And everyone was again, I said in one of our episodes, if your family's telling you to go to therapy, go to therapy. Because now I understand, right? And I think that the biggest thing with therapy is that it has given you and I both so many coping skills, and like to tie it back to death and grief, which by the way, full transparency, this episode was supposed to be about social media.
I don't know how we got here,
dude.
But clearly it's something that we needed to talk about.
We need to talk about it, and I think I'm like, damn, do I need to like connect with my people that have dealt with loss recently? Like, I think I need to talk about death more.
Yeah, I think it's time for another meeting with Shayla.
Yeah, I think it's time that I like. Oh shit, yeah, I gotta book that anyway.
Yeah, you do.
All of that to say that, like, I think that, you know, we started with suicide, and again, I have like really particular, I have no set in stone feelings about suicide because again, I think it's so layered and there's so many different circumstances. And so like, I don't want to speak in absolutes about it. I just believe in bodily autonomy. And I think that I understand why people are angry about it. I understand why people are hurt about it. I'm watching people I love, suffer every day. And like, it's so painful. So like, that's not to take away from the people that have lost people to such a terrible thing. I get it. I do. But I think that death is something that like we fucking have to talk about.
Yeah. And we avoid it like it's the plague.
All of us in some way or another. Cause now I think I'm pretty open about, you know, I love death. I watch horror movies all the time.
That's funny. That saying is even like avoiding death. We avoid it like it's the plague because the plague will kill you.
Because the plague will kill you. It is literally a part of all of our culture. Every movie we watch, everything that we do, all the media we consume. Like, I feel like so much of it is like how to live longer, how to like keep your youth. At the end of the day, it always comes back down to like avoid death as much as you can.
Yeah. Do everything you can to not
die. And at the end of the day, you're still gonna fucking die. Yeah. So like, you might as well talk about it.
Yeah.
Normalize it. Can we get back to like making funerals? Like, I think it's really appropriate to be sad at a funeral, but like, I think it's so cool how people do funerals in other cultures. And I think that it's because death in other cultures is a part of life and it's normalized and it's talked about. And I think that American culture has made death so taboo. It's taboo. Like, nobody likes death, but like, I do think that American culture.
Why did it become a taboo thing when it's something that we all do?
It's one of the only things that all of us will absolutely experience. Yeah. So why can't it be a connector instead of something that like keeps us separate? Yeah. Let your kids be scared.
Yeah. Well, and I think that's why we end up with people with like substance abuse issues who end up and with all these different like disorders and psychiatric problems because they don't know how to deal with the death and the loss in their life, whether it's an actual human or an actual living thing.
This is a good point.
Yeah.
People turn to substances when they lose people and when they're grieving because they're so uncomfortable with the grief, with the loss. No judgment, do it. But like, also, I imagine how overwhelming it would be if we sat here and contemplated like all of the ways that our fear of death and the tabooness of death specifically
and the inability to cope with it.
Yeah. Control or like plays a part in like other world or human issues like addiction. Fucking crazy. Think about how many circumstances of people that have lost other people where then inevitably couples get divorced. Someone gets addicted to something because they were so taken aback and so uncomfortable. Yeah. With the loss.
And then the lives that affects. It affects the kids
it's
in the
a ripple
situation.
Effect. Oh, it's God. I'm in a spiral. We're getting so existential right now. I'm like, holy fuck.
We need to wrap it here.
I need a fucking drink right now.
You're still here.
We love you for that.
Oh, look who's turning to substances to cope.
Oh my God, wait. I I know. I'm sitting over here like, fuck, is it too early for wine? I don't know, guys. Shit.
I'm unwell. Okay,
Call me out.
On
that note, we're going to wrap it here.
Yeah, like I think the takeaway is let's normalize death and let's
not shame people for every circumstance that they go through.
Yeah,
and we love you.
We support bodily autonomy.
We do, big time. Okay, where can they find you?
Listening.
Oh yeah, that too. But like, where can they find? Back to lighter things, social media. Where can they find you?
Find me. This feels so gross.
I'm fucking dying.
I am on all socials. Ew, how out of touch.
Yeah.
At Chloe Anna McKell. And you are?
I'm at Kelly A. Weld on Instagram and at Kelly Weld on TikTok. But I feel like instead of going through how to spell my name,
go to
Let's Get Taboo.
Yeah, we're on all socials. Yeah. At Let's Get Taboo.
Yeah.
Our personal feeds, if that's anything you're interested in.
I don't have any TikToks posted, just so you know.
That's okay. Mine are from 2 years ago.
That's cute.
And only astrology content. Maybe we'll bring it back. Vote here if you want Chloe to bring back her astrology page.
I vote yes. That could be cute. Anyway.
You can find us via our shared page at Let's Get Taboo.
Yeah.
If you can like, share, subscribe.
Yeah. Comment. We like nothing makes us hornier than like when people are interacting. Yeah. Like, so cool. Oh my God, let's go.
Someone's talking to us.
Oh my God. Because we want to interact back. Yeah. Like we're yappers if you haven't noticed.
If you haven't noticed. So on that note, thanks for listening. Sorry about this is a shameful plug.
I know. I thought you were going to say this is a shameful episode. And I was like, I think it's my favorite one to do.
Yeah, I love this. I'm so glad this came up.
I know, me too. Okay.
Love you guys.
Thank you.
Yeah. Damn. Where did that come from?
That was my favorite.
That was my favorite. I'm emo.
Let me give you a hug. I love you. I love you so much. Oh, so Chloe, I love you. I love you. I love you.
You smell like something from my childhood.